I already create myself. I see myself on the screen.
Okay. Oh, okay, great. So that is the most difficult part. So once the game begin, you will see a question here, and you actually will see the same question on your phone.
Okay.
I would say it's best to read from the screen because it's bigger. And then once you select your choice, you press go on your phone, and then you are in the game.
Okay.
I mean, it recorded your answer. So it's pretty simple. It's pretty intuitive. You will know how to play as soon as you see the answer. Lacroix, is that right? Could you unmute yourself? You are muted if you're trying to speak.
Yes, I want to get in.
All right. Do you know how?
No.
No? Okay. So open your camera, point it to the QR code. You will see a hyperlink show up. When it does, click on the hyperlink.
Click on which hyperlink?
When you open here, the QR code, you see it?
Oh, okay.
So open the QR code. Open the camera, I'm sorry, not the QR code. And then you should see a hyperlink show up.
Okay,
when it does,
put my name on there?
Whatever you want to put. You don't have to put your name. It can be any name you want, or it can be your name.
Okay, I just did that.
Perfect. So if you see, I see your name here. So now you are in the game. So now you just chill and monitor that your name doesn't disappear, because sometimes it does.
Okay.
So once the game begins, you select the answer on your phone.
Oh, okay, I see what you mean.
Yeah, so then it gets recorded. So you get more points if you're correct, obviously. You only get points if you are correct. But the faster you select your answer, the more points you get.
Okay.
All right, anyone testing tomorrow or the next day, or everyone is waiting for the crash course review to be done and everybody's testing after that? All right. Floor, I know you're probably testing soon. Who else? Sean, are you there? Manuel?
Oh, Dr. Lopez, how are you?
Oh, hold on. Let me just give some claps here, because I know you just did something amazing, man. Triple board certified, huh?
Thank you so much. I really felt so prepared. Like, I came to the testing center, I'm not anxious at all. So I'm never. I feel like every topic that you tackled throughout the reviews actually came out. You know, some are almost close to like verbatim.
Really?
You know, so that's really like, especially your crash course. There's a lot of information there that's actually, if you just like really don't memorize, you need to know the concept, because sometimes it changes the wording, but honestly, the answer is like screaming, almost like you already know, oops, that's the answer.
Really?
You know, so I came out like, doc, like, and it pops on my screen, you passed, like, oh my gosh, like it actually showed in my screen that I passed. So I was so excited.
Really? On your screen? Oh,
yes,
nice.
sir. The ANP. Yes, it showed like you pass.
Oh, man. So you actually took the ANP. I thought you took the
I'm actually preparing for the ANCC. So I would like to take it on Monday. If I receive my ATT tonight, like I would like to take it on the 20th.
Yes.
I feel so prepared.
Now, let me ask you a question. Did you take your diagnostic test?
I did.
Okay, good. All four of them, or no?
I actually complete all the four. I scored, I think 97. My lowest is 94. Because like I kind of reviewed before your review, but it's very sporadic, sir. Like it's spread out. Like I know a lot, but like it's so spread out. You technically condense it very concise. I even practice now. Like I was hired as a
Ooh.
medical director after I was certified. So that being said, there's a great future to a lot of us, and I can say that like I only recommend you to my class because I feel like your class is very I would say very helpful because you created these small little groups such as the WhatsApp, right? It
Yeah, the
actually
WhatsApp is very powerful.
It's very powerful. It's very encouraging. If you see a lot of people passing the boards, it makes you feel like, wow, if they can do it, I can do it too. And that's really a good feeling to have.
When you said that, almost give me chills because that didn't work out really well for me. When I was jumping from an airplane, I'm like, if this guy can do it, I can do it. Until I hit the ground, I was like, it got me back like 25 years ago. But I see what you're saying. No, it's very encouraging because we see everyone passing. So now, if you thought I got really close with the AANP, wait until you see the AANC. It will be even more close. I don't know if it's because I can only follow one blueprint, and I follow the ANCC. Word by word, you're going to see it. You're gonna walk in, walk out in an hour and a half. It'll be done.
Sir, I actually finished the exam an hour and a half, and I thought to myself like, oh my gosh, it's either I know the content or actually didn't read it because I thought to myself, I'm not really kidding. Okay, I felt it was easy. I felt this is an easy exam because it's my strongest probably subject is like psychopharmacology. And if you know your pharmacology, oh my gosh, you will nail the AMP. It's like they will not trick you, straight to the point. That's the answer. And it's actually in Dr. Lopez crash course. Dr. Lopez crash course.
Yeah, somebody told me that, after took the test, came back and said like the crash course cover everything for the AA and
oh my gosh, maybe like 40 question at least, 40 questions. That's your 40 correct answer if you know the content. Don't memorize the content. Yeah.
Good, man. I'm super excited for you. I think you said it's been a while. Did you say you are going to work with substance use disorders? Is that right?
I actually been in a substance use arena for the past 12 years. I am a family nurse practitioner, but I was hired to lead, minority groups, LGBTQ that at risk of addiction. So currently, I am going to run an outpatient, program here in Seattle, Washington.
Yeah.
Plus, I also have a private practice. So it's amazing, and I'm mentoring all those nurse practitioners that would like to specialize in addiction as well. So again, know your stuff because there's questions that numbers, like your CWAS, cow scores. They're gonna ask cow scores of 12. What you're gonna give, clonidine, it's almost at the border of clonidine and buprenorphine because 13 is buprenorphine, and you tackle that too.
Yes, we covered even that yesterday after the class. I stay over for an hour. So asking the students, tell me what you know. Let me ask a question because I get this question a lot. So for someone that's graduating or graduated and they want to specialize or know more about substance use disorder, is there any course you recommend that you're like, yeah, this is really good for them, or is anything that pops out in your mind other than the regular
stuff? If they're really passionate about it, there's fellowship. The University of Washington, there's a fellowship for addiction medicine. So you'll be a fellow. Another thing is be a member of the International Society of Addiction Nursing. I'm a fellow of that. I was inducted 2 days ago as well. If you want mentorship, I can mentor you. I meet with my students. I teach them how to taper patients in an outpatient setting, and how to detox alcohol, benzos, and buprenorphine in the outpatient setting.
Boy, you talked about a very good subject. Detox benzos. Guys, it is really
That's a long
hard.
paper, doctor. Like that's not easy. Trust me. That's the
It's really
longest.
hard. I think it's the probably the worst type of patient because
Oh my gosh, they're the one that really beg and kneel like, please give me more. It's not working. But you have to set boundaries.
yes. So I'm gonna, any students that, ask for some internship, if you're okay with that, I'll send you on your way and you guys can discuss
Absolutely,
how
sir.
to.
I'm giving them
definitely.
information.
Yeah.
Absolutely. And also, once they have at least 2 years under the belt of experience working in substance use, they can take the CARNAP, which is the
Mm-hmm.
Certified Addiction Nurse
Practitioner.
Practitioner, which is also a prestigious certification.
Yeah.
Not a lot of nurse practitioner has that. So, but all I'm gonna say
Wow.
is listen to Dr. Lopez and stick with him even after passing the boards.
All right, congrats, man. I'm super excited to see what's next for you. And maybe one day I'll stop by Washington to see your great work over there for sure.
Absolutely, and I still
Awesome.
promise you that I will create my testimonial video because
Oh.
that's the least thing I can do for you and for the other students that's still feeling lost and don't know where to go, because
Okay.
I still see a lot of people which is the best review. I just say Dr. Lopez, hands down. You know what I mean? So it's very affordable
Awesome.
too.
Let me ask you, yeah, I make it easy. I don't pressure. There is no monthly payment. I don't know how else can be easier, right? But anyways, last question for you. Where'd you go to school at?
I actually graduated from my postdoctorate certificate in family and psychiatry in University of Cincinnati in
Awesome.
Cincinnati,
Yeah.
Ohio.
We actually, were you like, no, I think I had a package of, for Cincinnati. I think 10 students joined our course from Cincinnati. So,
I
well,
actually asked them to go.
oh,
They're my classmates. I probably
okay.
yes, they're my classmates. I told them Dr. Lopez, and right now they're reviewing. There's on their first page because I'm the first ever in the whole program that able to take the board exam. So my dean was super proud that I already took the AMP, and a lot of people are very afraid to take the AMP and go into the
Oh,
AMPC route. But
yes.
again, I said I would take both because I would like to make sure
Yeah,
that I'm competent in
good.
field.
Well,
Thank you.
awesome. Very good. That's a good testimony, guys. So, is anyone new to the game today? We're about to get started in a little bit. If you are new, all you have to do is open your camera, and there is a QR code in the middle of the screen. You open your camera and point to the QR code, and you should see a hyperlink show up. When it does, you create a name, and then you know you're in the game when you see your name here. Okay, so you know you're in the game when you see your name right here show up. So once you're in the game, you have 4 choices. Remember, Kahoot does not allow me to put a full answer, so you have to do the best to kind of decipher what I meant to say, because it doesn't allow me to put a full answer. But it should be enough for you to get the main idea and know the question. It is extremely hard to make the podium because a lot of people will get the answers right, but it's not. That is the main important thing. That's what gets you points. But you also have to be fast. Okay, so if you don't get the podium today, your goal is the following week to be on Kahoot. Obviously, next week it's the 600 questions. We'll be sending out 600 questions via email or via the question bank. I'll send an email explaining who should do what, because we are going to have about 20 hours of crash course review on Saturday and Sunday. Not this Saturday and Sunday, the following Saturday and Sunday. So you guys need a break for the middle of the week to get your affairs in order, because we are going to spend 20 hours Saturday and Sunday, 10 hours each day of high yield content. And I promise you, if you really take the time to learn and understand, you will ace the board. Okay. So it's very good. So would it be automatically? I'm not sure what you mean. Would they start? Yes, it will. The game will start automatically as soon as I click start. Okay. So let's give a 5 minutes courtesy here, and then we'll be getting started. Um, at this point, anyone has any question about the content? Is there anything that's in your mind that is not letting you sleep? I know when I have something in my mind, I was like, "What is the answer? What is the answer?" I know it bothers me. So, is anything in your mind? Right? I know, man. Sometimes I wake up at 3 in the morning, but like, I was thinking about the medication. I'm like, okay, now I can go to sleep. Right? Uh, I know you guys been through that before. You know, don't even lie, okay? Ugh. One time I was working ICU a long time, and then I was like, did I do something? I went all the way back home, and then when I got home, I was in a shower. I was like, oh my God, did I do something? And then I just got out of the shower running, and then my wife was like, where are you going? I'm like, I got to go back to work, make sure that I did something with the blood that I was supposed to do. This person had kidney condition, and when I got there, I did. I was like, oh my God, it was a day, you know. It was a day to remember for sure, for sure. All right, so we're about to get started. At this point, Linda, go ahead. Linda,
Yeah, Dr. Lopez.
hi.
My question is this. I remember last week you gave us a login code to log in. Can you give that again?
Yes, it's right here in the middle of the screen. I'm circling. So you use the login code if you have the Kahoot app.
I'm logging to the website. I'm using
Okay, so do you have your phone with you?
Yeah, I'm talking to you with my phone.
Oh, okay, I see. So
Uh,
the PIN code is 5934 918.
okay. 5930.
No, four. I'm sorry, 593
Uh-huh.
4918.
4918. Okay,
Yes,
thank you.
absolutely. All right, folks, any questions about yesterday's content? So this is going to be one of the hardest subject and yet the easiest. If you still, once you get the hang of it, it'll
I don't see
become
my
very
name.
easy. Uh, because your name gets bumped down so the other folks can join in. But do you see your name on the app, on your phone?
Yes, I see it on the app.
Okay, then you are in the game.
Okay, okay.
It's just that other people joined and then your name you know, got kicked to the back. I hope that's what happened. Yeah, I see your name here, Isha. All right. All right. Anyone confused how to play the game? No? All right. So good luck, everyone. Remember, you have 1 minute, 1 minute per question. You get more points if you are fast, and obviously, you only get points if you are accurate. Think about what we learned yesterday and the day before. Some of the questions can be challenging, especially under pressure. Try to make the podium. You know you're the top dog when you're making the podium. But if you don't, there are over 100 of you guys here, 150, 100, maybe 180 folks here. Not everyone is playing the game, but it is extremely hard to make the podium. Okay? If you don't, it doesn't mean that you don't know your content. It's just that someone was really fast, extremely fast, and it is very hard. Good luck, everyone. The game is about to begin now. So if you're new, you're going to enter the answer on your phone. You select the best answer. All right, very hard question, right? Because you have someone manic that may pose a risk to themselves or others. But so is someone very depressed. And so is someone else extremely anxious, right? What you have to balance is the ability to respect the three patients' rights. Least restrictive environment is one of them, right? Informed consent, right, is another one. And what else? Anybody remembers the third one? Okay,
Confidentiality.
confidentiality. Now, anytime on the board, write this down. This is extremely important. You see two keywords here: safety planning. Never select, never select. I'm saying almost, I don't say never for anything in psychiatry, but you never select safety contract. Why do I say this? Because it's an ANA statement. What is safety planning and how is it different than safety contract? Safety plan is a collaboration. So let's tie down to what we learned yesterday. There is a lot of lecture or a lot of points that ties down to collaborate with the patient to develop a safety plan or planning. Okay. So these five folks are took the podium here for now. Your job is to kick them out. So this is the best answer here. Collaborate with the patient to develop a safety plan, engage them in the decision-making process. When you engage them in the decision-making process, what is this? Is this the medical model or is this the patient-centered model? So that's another topic that we covered yesterday, right? So just connecting what we learned yesterday to the question that you see here, okay? So talking about autonomy, respecting the patient autonomy, saying you are going to be committed involuntarily, you are not respecting the patient autonomy. We could even say ethical principles such as beneficence, which is, so collaborating with the patient with safety planning, you are promoting the patient well-being. How about laws in psychiatry? What O'Connor versus Donaldson says, that if one mental illness alone is not a reason to justify involuntary hospitalization alone, right? Patient didn't have a plan, didn't necessarily say they are a risk to themselves or other. We can, the questions that may pose a risk. How about the patient-centered model versus the medical model, right? Collaborating with the patient versus saying, hey, you are going to be admitted whether you like it or not. So at minimum, what I want you to take it away from here is that if you see collaboration and if you see safety planning, that is extremely powerful, okay? That is extremely powerful. Most likely the answer. Think about being active with the patient, respecting their autonomy. Just because you may have the power to admit someone involuntarily, it doesn't mean it is the right answer, right? Think about least restrictive environment. So as you see, lots of things that we cover this week shows up in a question disguise. What does it mean to you? Do not memorize the content. Understand the content. Okay? All right, next question. Very hard question, okay? Don't be fooled for this question. It's very hard. All right, 5 seconds. Pick your best answer and go. All right, test taking strategy here. We can cross A and D. They're basically saying the same thing. Admit the patient. Have the patient admitted whether they want it or not, in layman's terms here. Now, the question becomes why the blue option explain the risks of refusal, document it, and assess for safety. Slightly better than respect the patient's autonomy and provide outpatient option. Guess what? The two answers are the correct answers. However, you can only pick one. Which one of the two answers would still respect the patient autonomy, but still cover your legal obligations of documentation and assessing for safety, right? B didn't say necessarily you're not respecting. You are going to explain the risks versus benefit, or the pros versus con of being admitted. So you're providing teaching, and you are going to document, and you are going to assess for safety planning. That's why I said this is a very hard question, because B is a true statement. But which answer would be the better answer of the two? Okay. Extremely hard, and I get it if you pick the orange color there, the C. Totally get it. Okay. So explaining the risks of refusing hospitalization, documenting the refusing assess for safety risk is the most appropriate course of action to respect the patient's right while addressing potential risks associated with manic state. Okay, so very close related answers. Just one is slightly better compared to the C. Now, again, let's talk about laws in psychiatry. What is Rennie versus Klein? Patients has the right. The patient has the right to refuse treatment. Right? Is a court case that established that involuntary admitted patients, of course, uh, by the extension of highly symptomatic voluntary one, right? So one has not been found incompetent and has the right to refuse psychotropic medications or treatment in a non-emergency situation. So I'm trying to tie in the cases that we saw yesterday with the content and how it may fit this scenario. Again, if we look at the AMA statement, standard of practice, remember what is scope of practice? What you can and cannot do, dictated by the state. When we say standard of practice, you should think of quality. And who dictates what quality looks like? ANA is determined by American Nurses Associated, which is nothing but the authoritative statement regarding the quality of care. Okay, look at this board pearl here. Look for answers that document and educate. In this case, even though documentation was, written, but when you're documenting and discussing the case, you are also providing education. On the exam, documenting the refusal is a legal shield that that helps you meet the standard of care, even when the patient exercise their autonomy, which we should always respect. In this case, a refusal to be admitted. All right, next question. All right, we got 5 seconds. Pick your best answer. All right, so very good. Very well. So I don't think there is much to explain here, right? So at 19 years old, they do we need to tell the parents? Should we tell the parents, right? Most likely not, right? So respecting the patient's confidentiality. The question is, when can we break confidentiality? There are certain situations that we can and should break confidentiality, right? So we want to respect the patient's autonomy, and we look at the age here, right? The question becomes, what if it's a minor? Then you have to balance the need to know versus the patient's autonomy and risks involved, right? The imminent risk. If the patient says, I have a plan and an intent, then you can break confidentiality. That is not the only way, the only condition in which you can break confidentiality. Minors, you may need to break confidentiality if they are at risk. There are other instances. HIPAA fully protect the disclosure unless disclosure of a of electronic patient, medical records or talking about a condition unless if the other person is directly involved in the treatment, right? At 19 years old, we should not disclose that to their parents. Okay. So now I just want to take a second here to look at the exceptions in which you could most likely break confidentiality. When there is intent to harm self or others, always when children and elderly are involved, you don't need permission. With a caveat, you need to assess first. Just because you think you saw something, if there is an option to assess first before you report to CPS, that is the option. Your job is to assess. You are master's prepared, doctorate prepared. Your job is to assess. Now, talking about the Tarasoff principle, remember, you have a duty to warn, but you are taking a national board. Remember that not every state enforce this principle, and you are taking a national board. So always one is a safety answer, calling the police, and possibly calling the state board of nursing because they dictate they dictate what you can and cannot do in the state that you work at, right? What are the other mandates that you can and should break confidentiality? Well, if the judge says, "Hey, you got to give me your medical record," then you don't have to ask for permission of the patient. It would be nice if you communicate if someone is involved in litigation. How about Medicaid and Medicare, right? I mean, how else they would pay for the bill? So you have to um, provide some context of what was provided, if not the full report, so that they can pay the bill. And mandatory diseases reporting, which doesn't necessarily apply to us, but it could, right? So think about how about HIPAA and psychotherapy that is even more restricted. Last thing here is remember the two release rule. If someone has a psychiatric condition plus a substance use disorder, you need two consents of release of information in order to release the records. Okay, those with substance use disorder, they are even more restricted. Okay, or restricted, should I say? All right. Again, a very hard question because now we are dealing with a 16 years old with self-harming behavior and suicidal ideation. Says, please don't tell my parents, right? Now we still want to negotiate. You still want to be able to kind of talk to the patient, say, look, I don't think this is a good idea, and so forth and so on, right? Instead of completely saying, hey, I have to report this to your parents. So discussing with the patient, involvement. So basically here you are doing what? The you're doing you are respecting someone, please. Your audio is on. Okay, sorry about that, guys. All right, so you want to discuss with the patient the possibility of involving the parents and exploring the possible consequence. Okay, so these questions are hard. Okay, so you have to think through and see which one truly respects the ethical principles in actions for this situation, and that is the answer here, D. Um, so, all right, next question. Mm. Respect the patient's autonomy, involve the parents only with the patient consent, right? So that is the key here, only with the patient consent. So, yesterday I was playing around. They said, I'm married. If my wife calls the hospital and she says, I want to see his medical records, can she see it? Not necessarily, only if I allow it to, uh, authorize her to see it. So even family members, they need consent in order to see someone's medical records. Think about this: when somebody calls the hospital and says patient X is there, do you say, yeah, he's here, or do you say, hold on a second, and then you ask the patient, hey, there is someone here named Mary who wants to talk to you. Is that okay to say that you're here? Right? Some places are more strict than others. Okay. All right, so most of you guys got this one. So contact local authorities. The authorities in the patient states to report suicidal plan, right? So again, um, can be a little bit difficult just by saying suicidal plans. but contacting local authorities, the patient states report the patient's suicidal ideations and plan is a legal obligations when there is a clear threat of imminent harm, right? This action ensures the appropriate intervention can be initiated to protect the patient's safety. Okay. All right, next question here. All right, 10 seconds. Perfect. Okay, so that's not the time to respect the patient privacy, and so we talked about when should we break confidentiality. So this is a perfect example. Contacting law enforcement would be the best answer here, right? So you are legally and ethically obligated to breach the patient's confidentiality and contact law enforcement or potential victim to warn them about the threat, as outlined in the Tarasoff principle. If you look at the end of the question, it says according to the Tarasoff principle, right? So basically it's saying, hey, what is the Tarasoff principle? But here was very kind to say contact law enforcement. Law enforcement, you can contact any state, right? If there is a threat. All right, 10 seconds. 4, 3, 2, 1. All right, so yesterday I screamed my lungs out and I said, you need to know PICO by the letter. This was not a very hard answer, in exception of comparable or so, right? So they will make it an easy topic turn into a hard question. So I'm actually glad that we kind of some people made a mistake, so it kind of proves the point to what I was saying. You need to know peak. What's the P, the I, the C, O, and T by the letter. Otherwise, you will lose a easy question. Okay, a easy point. All right, so the quality and strength of the research design and methodology. Most of you guys got that. Statistical significance of the research finding. What does it tell you? Does it tell you the probability of what they found is actually what they're looking for, right? But you want to look at the quality and the strength of the research design and methodology that assess how how the study was conducted, the rigor of the research, and how appropriate the methods were followed, right? For potential against potential bias, because you still could still have a high P and not be a good research study, right? But also you want to have obviously a good probability of what they found is actually what they're looking for, and you want to have a good sample size as well. Otherwise, it would not be a good quality and strength of the research design methodologies. All right, 5 seconds. All right, so research doesn't prove anything, much less guarantee. It strongly suggests that we, according to the research, we should probably follow this guideline, but it doesn't guarantee per se. Okay. It's almost like a compass to what we should or should not do, right? But it doesn't mean. Yesterday we went over one of the best CPG or clinical guidelines for bipolar, and we compare med by med, but it doesn't necessarily mean it is the best evidence. But you still need to take into account the patient. What is the patient? What is that the patient wants? You can have the best solution, but also taking into account what the patient wants. Okay? All right, so I may have guided you wrong by saying that select a single guide. Well, it says a single guidelines with personal treatment preference. Sure, if we want to do a treatment preference, but here at the end of the question it says scenario best represent the appropriateness of using evidence-based guidelines in clinical decision making, right? When you propose to do something clinically, you want to look at several guidelines from reputable sources and recommendation. You can find horrible things about any medication if you look at Reddit, Facebook, right? So you have to look at the right place in order to find something that is credible. Okay. So yeah, so explore least restrictive environments like intensive outpatient or crisis unit. Just because someone is having not just hallucinations, is having hallucination doesn't necessarily mean it must be involuntarily admitted, right? So respecting the patient's autonomy and promoting their integration into the community while addressing their PH needs. Right? When making policies, we have to remember FIE, formulation, implementation, and evaluation. So formulating and implementing regulation to improve access to behavioral health is the best choice here. All right. All right, 10 seconds. All right, so this is a hard question too, right? Let's see the rationale. I thought it would be even harder. More people would pick the incorrect answer. So forming a coalition with other healthcare professional advocacy groups and stakeholders who share similar goals is important step in effective policy making. Remember, joining organizations alone, we can do nothing. But if 100 or 1,000 of you guys demand something in your state, if you're joining an organization that will make things happen, things will happen. But if you just sit back and accept anything that comes in your way, then that's what will happen. Okay. Strength in numbers, absolutely. Very powerful. Right, 10 seconds. Right, so we know there is a problem, but we don't know what kind of problems is, right? So medication is being passed incorrectly, but we know why. So we need to collect data on the problem and then go to the research to find out the answer, right? So assessing the learning needs of the staff, if we don't even know what is the problem yet, that will become an important thing once we know what is the problem, right? So how about initiate staff training on administration techniques to prevent errors? Great answer, but if we don't know why, what is causing the problem, how we're going to teach them, right? And we definitely don't want to call the pharmaceutical company. That would be a disaster. All right, very good. So yesterday we talked a lot about just culture. So I'm glad that everyone agrees that we need to fix the system rather than one person is the problem. Now, once we fix the system, if the person continues to make the same mistake, then that person needs to be held accountable. But it's not about blaming someone, it's about seeing or looking for errors, what have contributed to the medication errors or whatever issues happening in the unit, right? All right, 5 seconds. Pick your answer. All right, so almost 100%, very close. So it's moving on. Jesse, on fire there. All right, anytime you see quality improvement, you should think about 2 things immediate. Retrospective chart review or PDSA, which we covered in detail yesterday. So this is obviously is to look at the charts with a clinical um, tool to evaluate if the care provided, so therefore we can improve going forward would be the best choice, right? Things may not be word by word, but you can get the scenario here, right? Identify trends, triggers, pinpoints area for improvement. The data analysis forms the foundation target for quality improvement going forward. So we need data to see or analyze what might be the problem. And then when you are ready to change, we use the PDSA process that we talked about in detail yesterday. The order matters, okay? Right. So would you gather data if you don't know what is the problem? So you have to identify what is the problem in order to gather data, right? That's why I was trying to say the order matters, because it's really close to the correct answer, but you can't gather data if you don't know what is the problem. Okay? So you identify what is the problem first, followed by developing and implementing interventions to address the issue, subsequently monitoring the outcomes and allowing for assessing the effectiveness of the intervention. So the gathering data supports ongoing evaluation and adjustment. So this sounds like more PDSA process as well, right? Right. After you identify there is a problem in the unit, what should you do? You want to get with the team, the quality improvement team in the clinics, and including those stakeholders, those involved, in this case, nurses and therapists. Okay. So you don't want to necessarily, it's not a bad thing to conduct a patient satisfaction survey to gather their feedback. That is probably important. But once you identify there is a problem, what first needs to happen is getting the team involved, the quality improvement folks involved, and then everything else follows after that.
If I didn't find the problem, then I'll do the survey, right? If I don't have the problem already.
Yep, absolutely. All right, so yesterday we talked about performance improvement. Anytime on the test you see performance improvement, immediately you think about two things: retrospective chart review with the tool to analyze the data, and PDSA. You need to know PDSA by the letter, just like PICO, just like CAGE. Okay, I would not be surprised if there is a question that asks about PDSA, what is the P, the D, and then you might not know the answer. Now, what is the P? For plan. You're going to plan what is going to take in motion. How about the D? Or the do is the implementation of the plan, and then you study. Which of the following answer is studying the problem, analyzing the data and results to assess the impact of the change? Once we do that, is the act. What is the act? I call it the rewash, or finding out, did it work or it didn't? Okay, it improved. Now we do another cycle, and then we do again. We implement, we do the plan again for the next cycle, then we do the implement, and then we study the data, and then at the end, if the problem wasn't solved, we do another round, right? So this is the PDSA cycle for performance improvement. I almost guarantee you will see questions on PDSA. All right, 10 seconds. All right, so I don't think there is much need of explanation. Cultural care, listen to the patient, try to understand what they're coming from. Don't be judgmental. And for most of the answers is all about educate me, help me understand what is you are going through, right? Seeing the problem from their own perspective. And how do you know this is a cultural question? Somebody from Zimbabwe, somebody's from Japan, from Brazil, whatever. If they start the question, someone is from somewhere and they present a psychiatric problem, the answer is usually not a scientific answer. It's all about cultural response to care. Even if it's against your best judgment, if someone appears to have an infection, option A will be collect culture and sensitivity or provide fluids. That would be the wrong answer. If it's a cultural question, try to understand where is the patient's coming from. And if you don't understand what is they coming from, say it. Help me understand how does it apply to you in your culture. These are the answers that they are looking for. Okay. Okay, 5 seconds. All right, perfect. Well done, everyone. Okay. So acknowledge cultural mention, but prioritize the clinical assessment. Again, this is going through, going towards the medical model. We want to explore what it means to them, what the beliefs, the healing beliefs as an essential part of the assessment, right? Not so much what we think is happening, but what it means in their own context. All right. Pretty easy. All right, 4 seconds, pick your best answer. Yeah, this is all about existential therapy, right? Think about beliefs, values, and specifically challenging the patient's responsibilities for their actions, you know. Existential concerns, finding meaning, developing coping strategies for existential anxiety. All right, sorry about that, guys. I think the answer didn't quite match. But how do you kind of decrease? Sorry about that. The answer did not match. How do you decrease the stigma of mental health? Right, by education. Education is the answer in reducing the stigma associated with mental health. What else? Advocating is another form of reducing the stigma of mental health. What is the third topic that we discussed yesterday? By increasing availability of service. These are the 3 ways that you kind of advocate and reduce the stigma of mental health conditions. So yesterday we talked about a patient with Alzheimer's. Can they provide consent? Yes, they can provide consent. as long as they understand the treatment, they are not being forced to take the treatment, right? They understand the alternatives, risks involved, and benefits. As long as they can tell you, hey, I understand what is going on. It does not matter if someone has a diagnosis of bipolar, Alzheimer's. Obviously, they cannot be in crisis, right? That would affect their understanding of the procedure. But anyone can give consent. Understanding the elements of the consent will be important for the board. All right, we got 5 seconds. Take the best answer and go. I found that the patient, they are legally obligated to report thoughts of harm. This is an extremely hard question, right? This one is like, oh my God. So, there is a line that cannot be crossed. If there is an imminent danger, then there needs to be a report so that you are keeping the patient's safety. What if the patient gets arrested because they reported to you that they have thoughts of harming someone? The outcome of being arrested is not what we're looking for. We're looking to protect the patient against committing a violent act against someone else. If they get arrested in the consequences of that, so be it, okay? It's not this case, but it's similar here, in which one may be at risk to themselves in this case. So we have an obligation to take steps to ensure safety, right? Which is reporting the information to the appropriate authorities.
Without a plan?
Well, if I didn't take a picture of the scenario, but it sounded like self-harm and intent together. It didn't necessarily say I have a plan. You wanted to avoid going to this step by having a safety planning collaboration with the patient if all possible, but that choice wasn't there. So it's a hard question for sure. All right, so glad that everyone picked up on the cue. Justice is doing what is fair and right for that population. So addressing healthcare disparities and advocating for equal access to care. So yesterday we went in length talking about the ethical principles They are pretty easy, but we need to make questions and think of scenarios, because they will never ask you what is justice. They'll give you a scenario. So understand how its application, it is what the board will be looking for. All right. So who made it the podium today? All right, John, good job. Rose been making the podium very often. So Jassy, good job. All right, Ducky and Bass. Hey, everyone made the podium, right? Everyone really did super well. Um, it's only 5 spots in a podium, right? And there were what 130 people playing the game, and even more showed up today. So that's a great opportunity to meet and kind of get those questions out of the way. Remember, next week, the middle of the week, we will not have classes because we'll be meeting on the 25th and 26th of this month for the crash course review. So your goal is, I'll be sending 600 questions via email. Which questions should you do? It depends. Let me open the question bank. If you're about to test, then you should focus on the crash course question bank, the question bank module. If you are not testing soon, then you focus on the 600 question, which is the content that will be covered in the crash course review this weekend. Now, I still have folks asking and not knowing where it is the question bank crash course review. So let me share with you, because these questions are extremely high yield. They will help you pass the board, along with the diagnostic test. These are new. I just added that 100 question in the last 3-4 days, which was day 4, day 5. Now, some people say I can't see them. They are not there. They expand and contract. Now, these are the questions. If you have the time, if you want to, there are more questions here. What I would like you to do and not skip is the modules 1, 2, 3, 4, and 5, right? And specifically must complete the crash course review questions. Do not skip. I promise you, if you do these questions, you probably get an extra 40 questions right on your test. May not be word by word because I don't know what is in a test, but looking at the blueprint, I have a very good idea what they might be asking you. So do not skip those questions. With that being said, that ends today's event. Thank you everyone for being here. We'll be getting questions, lots of questions. It's going to be a busy week for you, and I will be creating more questions. Don't be surprised that by Saturday, we are on day 7. There'll be another 100 questions here. Those questions are made by your questions. Every time you email me, I identify a possible problem that someone doesn't understand something. So then I go ahead and create the questions for you. And if someone doesn't understand the content, most likely there are others that don't. So please don't skip this step. Be on top of it, having your calendar and accomplishing modules 1 through 5 early is the solution for the board. Okay, so thank you everyone.
Thank you, Dr. Lopez.
Dr.